everyone, and welcome to Autism Hope Library. I have a very special guest. Dr. Alan Lewis is here today with us, and we're going to be talking about treating autism with integrative medicine and the listening program. Well, welcome, Dr. Lewis. I haven't seen you for quite some time. It's nice to see you again.
Great to see you again. It's been, I think, a little over 10 years. Isn't that
that was one of our very first interviews that we did way back in the day. And so it's so great. If you guys missed that interview, you can find it on our YouTube somewhere down the way. But we visited Dr. Alan Lewis at his clinic, and we've been following you ever since. You're a very busy man. You're hard to get another interview with.
Well, I wish it wasn't so true that there's so many sick people out there, but we have been busy. I thank you for taking the time, though, because as you know, we're trying to help families help their children help themselves, and it's a tough road.
It really is.
There's hope,
Well, we're so honored, as I said, to have you again, and you're just a wealth of knowledge. For those that are watching, can you tell them a little bit about your background and your experience and what brought you and kept you in integrative functional medicine?
Yeah, I appreciate that. I started in traditional pediatrics, and if I look back on my medical career, I always wanted to be a pediatrician because, I just love kids so much. And then my son was diagnosed with autism at 2. And that really rocked my world, as you can imagine, as it continues to do for many families. We were told there was nothing you could do, and that really wasn't true. Interestingly enough, the day he was diagnosed was the day the National Academy of Sciences came out with their report educating children with autism, which said do behavioral therapy. And so we did, but we didn't hear about the biomedicine approach, didn't hear about diet, didn't hear about other things. And then thankfully, his mom found out about Defeat Autism Now, and I went to the first conference and learned a lot, and really understanding that what we were seeing in autism wasn't necessarily set in stone. We were dealing with a child with a biologically impaired brain that really need to be unimpaired. I know those aren't necessary words, but that's the way I think about it. So if we can unimpair that brain, give it knowledge it needs, give it situations it needs, and it can learn. And the diagnosis is really based on the neurodevelopmental delay. So if we can allow the child to learn, then they can catch up development. And that's what we saw. I eventually went on to be medical director at the Pfeiffer Treatment Center. So expanding upon some of the things I learned, in Defeat Autism Now, I learned about biochemistry and behavior, and then ultimately went into integrative practice, where I've been now for about 10 and a half years. I would say the learning has accelerated since I've gotten into practice here. There's other things we treat. More than 50% of our patients have PANDAS now, and a number of have Lyme, and mold illness is clearly starting to predominate, as all comorbid or also disease-causing processes in what we're treating. What's kept me in integrative medicine is many of these families have come to us for help, haven't received it in other situations, and we do actually see kids get better, which is the whole reason I went into medicine, to tell you the truth, is this to help families, to help kids get better. It's a continuous learning process. And I would say that's when you kindly said, I'm busy trying to learn. That's really the big thing.
Well, we're grateful that you continue to learn, because without doctors like you, our kids wouldn't be doing better and wouldn't be feeling better and wouldn't be getting better, as you said. So we're very grateful for that. I know that in your practice, you have found, common threads with underlying diseases. When you're looking at the diagnoses of autism and PANS and PANDAS and tick-borne illnesses like Lyme disease, we're hearing so much more about, and mold illnesses. Can you talk about those common threads that you're finding?
Yeah, I would say that it's very interesting how we're seeing so much of things we even talked about in autism 20 years ago. We talk about toxicity, stress, and inflammation. And it was pretty clear. I know that some of the published studies go back to 2006, when there was evidence of inflammation in the brain of children with autism. So we're like, let's focus on, inflammation and what triggers it. Well, that stress, toxicity in many senses, we've heard about heavy metals, but there's pesticides, There's imbalances in chemistry, inability to detox toxin in the case of a mold illness. In the case of PANDAS, we have an autoimmune inflammatory response that's just taking over the brain. So it's a vicious cycle of those three that really beget more inflammation and lead to the illness. It's not just the brain, though, as we know, it's other things that are affected as well: bowel, thyroid function, immune function especially. So it's the fact that we have these three stressors that are starting to affect all elements of the body that really are a problem.
Well, and I know today we're also talking specifically about the listening program and how it fits in the care of your complex, patients. So many of our kiddos are very complex. Can you share how you first became interested in the listening program and how you view it as a useful tool in your practice?
Well, it was thankful for that you really introduced me to Alex Doman, through the Autism Hope Alliance board. And when Alex and I first spoke, we were talking about it, and I was like, well, this sounds like a very good modality. As here we have a chance to use music, which most people enjoy, to actually help with development, and it became so much more. I would say, I was thinking, okay, maybe this is something that we would use in the autism patients. Definitely. We had great response, but then we were able to expand it to the other patients, the patients with PANS, the patients with Lyme. And it gave me, I had to say, okay, well, now why is it working in these other illnesses? And part of the answer goes back to that idea of stress and inflammation and toxicity. Sound can be toxic, thoughts can be toxic, stress is toxic, So in many ways, we're seeing the listening program helping de-stress the body in many ways. So I think that we really haven't tapped all of its potential at this point. But I was just amazed at what we had seen, and I know I was told to prepare some examples of what we've seen, so and I imagine we'll get to that, and it's pretty profound.
Yeah, I know that we've been using the listening program for well over a decade with my son, and he requests it. He loves it. He knows when his body is in a fight or flight kind of mode, and will literally tell us he wants to listen to his music, which then is even expanded to the sound health, where he'll pick the albums on the sound health version that isn't quote unquote therapeutic, but therapeutic in the sense that it's a non-toxic noise and it's something very relaxing for him. So
Wait, when you have a child that says, I want this, now in the case of a screen, that's screen dependency, right?
yeah.
Which is good. But in the case of, when you have the listening program, I want my headphones, or I want my music, or I had a kid that, cried until they rented the HBOT the next time, or kids that even asked for methyl B12 shots. It's like, okay, I want a shot. Well, it better be doing something, which it is, because they know. And that's one of the cool things. It's rare that we have difficulty once people get adjusted to the TLP of, being able to, have them do it, because they're going to want to do it, and you take 2 days a week break, that sometimes can be a tough time because they really want it.
Yeah, we do sound health during our 2 days a
That's a
week.
good idea.
Yes. So for those that are listening, sound health is where it's just beautiful classical music. It's not quote unquote therapeutic in the sense of the TLP, the listening program, but so you do 5 days on, 2 days off. But it's he requests it. And so our days are Monday through Friday, but Saturday and Sundays are off, and Saturdays and Sundays are relaxed. And it's really awesome to see him go on the iPod and like pick the sound health that he likes, because we had it put on there as well. And so it's nice to see him be excited on different albums, and he knows certain, like he'll say, oh, I want this color, and yet I'll look at the color and it will be a calming one, or it'll be an inspirational one. And it's fascinating to me, even individuals with limited language really can express their wants and desires when it comes to music. So it's something that obviously is near and dear to my heart. So it's exciting to see doctors like yourself get so excited as well. Now, can you share some thoughts about stress and how it interferes with our ability to heal? Because honestly, so many of our kids are in fight and flight.
Well, I'd say so many of us are in fight or flight,
Yeah.
parents and kids and friends. That's part of it. Stress has many negative effects on the body. You know, it causes inflammation. So we know how bad that is. That inflammation then can go on to negative effects, not only in brain, but bowel function, immune health, adrenal health. So our energy, thyroid health, also for our energy. And so when we have this ongoing stress, we can actually get ourselves into this self-sustained pro-inflammatory cycle. And we need to break it. And we can break it certain ways. You can break it with good sleep, good nutrition, exercise, mindfulness, meditation, listening to good music. Those are all things that are helpful. But TLP gets in there and, for 30 minutes a day, 5 days a week, you can have a profound effect. So that's really where TLP I've seen have a big impact. I just recently did a conference that talked about all the illnesses we mentioned, but at a very, at the sickest of sick level for patients. And they talked about two concepts, the activated and autonomic nervous system. So that part of our system that we think of as unconscious, and how we respond to stress is partly related to how our autonomic nervous system is set. And so if we're in fight or flight, we're going to have worse response to stress than if we were relaxed. Similar to where a brain, with a concussion, if they get a concussion too soon after the second concussion will be worse. And then the other thing they talked about was something called the cell danger response. And I'm going to be writing a blog on that. But it's very interesting that if we think all the way down to the cellular level, the cell can respond from stress and put itself into a self-protected mode and not want to get out of it until it gets a safe signal. And one of the things I think, at least the listening program does, because you have the bone conductor, on the head, you're getting vibratory sense too. And vibration or bone conduction is the first hearing we have in utero. So when I think about what's going on, with the Waves headset and with this engineered music and the bone conduction, is the body is getting a safe signal, which is trying to help the cell get out of, that hunkered down, non-responsive mode. And vibration on the skull is going to go all the way down to your toe because your skeletal frame goes all the way down there. So you're not just giving it to the brain, you're probably giving it to a lot of the body. And so, that stress response is something that I'm really starting to understand is something we have to focus on primarily in our patients, not thinking about, do they have mold illness or do they have Lyme as the primary, is the stress and all these things that have gone on to their protective mode that we need to help them with. So
I think that's it's so fascinating listening about, just things that we can do to help our bodies heal, and music being really such a simple thing and yet so overlooked. So I'm just
right.
so happy we're talking about this. And we talked a little bit, or you mentioned it, I should say. We had asked you to, think of some great success stories. Have you seen significant responses with the listening program? And can you share a few of those success stories?
Well, tongue in cheek, there's a integrative physician of undisclosed age who finds that, the listening program is very helpful for mood and stress reduction, good sleep, and it actually helps me, with my seasonal affective disorder. So I do achieve, at this point. I haven't gone on to level 1 or the other things, but it's very powerful for me, and it's also helped my wife. I have two patients that really have done well. I've had multiple patients that have done well, but two that I really wanted to highlight. So I know I'm not supposed to read, but I just don't want to forget, how good these two were. So one, I remember, he's now 26, but when we first saw him, he was about 22, and we dealt with the traditional things we did for kids with autism, but he was aggressive, he was not potty trained. He was very sound sensitive. The family was stuck at home. Dad was just amazing. He needed to be his therapist so that when the patient became irritated, Dad would sing and help calm him back down. So Dad spent hours a day singing. Um, that improved, but when we added the listening program, things just took off. So he actually potty trained at 24 within 6 months of
Wow.
starting TLP. Yeah, you know that as a mom, right?
Yeah, that's huge.
Really awesome. His sound sensitivity improved dramatically to the point that Dad didn't have to sing all the time and they could go out. And now he's even to the point that he's more creative, playing more. He understands jokes, and he's even kind of putting words and melodies together in his own way, humming to some degree like his dad. So, many people think that, there's no healing after a certain age. That's not true, you know, and especially in his case. And I don't think now that he's 26, so he's 2 years after, some of those big gains, he continues to make gains. So we just don't know where he's going to stop. So that's awesome. The other one is a kid with autism too, but he also had pretty significant PANDAS, Lyme, and mold problems, and had pretty persistent PANS flares for 5 years. We saw him tried to do some of the things that we usually do and had some success, but he still was flaring. Within about 6 months of TLP, he stopped flares. So that was the first time he completely remitted his flares,
Wow.
within 5 years. And since that reset, so, what really happened is, his brain started to heal. The rest of his system started to heal. He had tracking breakthroughs. He had been stuck in visual developmental optometry for 2 years. He was starting to make gains academically, with reading and math facts, those kind of things. He became calmer. So his temperament improved. He was actually able to engage more. How much of that was his inability to trust his own ability to respond? I don't know, but kids want to do well.
Mhm.
And now he had the skills to do so. So we're seeing social improvements, independence with his ADLs. One of the things that I thought was really interesting, he came from a running family, so all the families were runners, and they noticed as he started to really respond to TLP that he started to change his gait.
Oh, wow.
So he went from a rigid, non-flowing gait, something that a runner would recognize, right, to one that was the more normal runner's advanced flowing gait.
Wow.
Yeah. So, I think, again, as I've said, I just don't know where, things are going to stop. I don't want them to stop, of course, but it's been just really something. For a small investment, we've seen great response.
Well, and I know you know this about me, but it's also true with the Autism Hope Alliance. We believe that children of any age are capable of limitless growth. And we see it over and over and over again. And I hear the stories like this. And, if you're a family out there watching and you think, oh, I keep hearing there's this window. I don't know what window and what house this is being built in, but I don't think there's any window that closes. I think that our kids are going to constantly climb a ladder and just keep shooting for the stars. And so it's something that to me makes no sense when you hear quote unquote the experts say, oh, if they don't do well by age 5 or age 8 or by age 12, and I constantly hear all these different numbers, then that's probably where they're that's where their cap is. Like they're not going to get,
We don't want to, speak a self-fulfilling prophecy over them.
no.
Sky's the limit. We've seen healing at all ages. Even when I was at Pfeiffer, we had guys, and I think a patient 35 gained 5 words, and a patient that was 50, added 2 or something like that. And it doesn't seem like much, but their care became so much better, and just the idea of frustrated communication became that much less.
Well, and I think like you said earlier, you're still learning, you're constantly learning, you're not giving up. Well, we can't sit there and say we know everything when the doctors who are helping us are still learning. So how can we say we can't predict the future, but we can predict we're never going to give up. And I think that's really where the key message is. How do families find you? What website can they find you on?
They can go to sanctafamiliacenter.com. So it's SANCTA FAMALIA center.com. And our phone number is 614-259-3760.
And, for those families out there watching Dr. Lewis that, are just thinking, gosh, well, first, I'm sure they're listening going, I'm so glad that he said kids of all ages, because that's right there. I don't care where your kid's at. You love hearing that. But sometimes you still feel like lost. You don't really know where to go. There are days that are really harder than other days. What message can you leave with them?
Well, I mean, there's always hope, really. It's trying to find folks that are actually going to also lift you up. That's where it's very important to have what you're doing, the Autism Hope Alliance Library, connections in other ways, connections with other parents, those are all useful things. I just never give up.
Yeah.
I mean, you know,
I think that's the best message we can always say
Right.
and always remember is to never give up. And we're just grateful for doctors like you, Dr. Lewis. And thank
Right.
you for not giving up. And thank you for continuing to be a student and continuing to learn and just, know that our kids are in there and they're just going to keep surprising us and keep showing us and keep teaching us. So thank you, Dr. Lewis, for being here today and all that you do. And thank you that are watching. Remember what Dr. Lewis said, just don't give up. We're all in this together, and Dr. Lewis and many doctors like him are not giving up on your kiddos. So you don't give up either. All right. Until next time. Bye, guys.